Hello everyone, this is Dr. Sangeeta Chaudhary once again. I welcome everyone to my lecture class, and in my today's class I am going to talk about the history taking of gastrointestinal system. Thank you so much everyone for appreciating my classes. I was getting many requests about history taking on gastrointestinal system. So here it is today. I am going to discuss about the history taking if there is an involvement of the gastrointestinal system. So first of all, let's talk about the chief complaints of a patient who may come with the involvement of gastrointestinal system. So what could be the chief complaints? One of the very common chief complaints can be pain abdomen. The other chief complaints can be nausea, vomiting. There can be complaint of abdominal distension. There can be complaint of jaundice. There can be complaint of pain abdomen associated with fever. So these are the common chief complaints someone will have if there is involvement of gastrointestinal system. So let's discuss about one by one. Suppose a patient has come to us with a complaint of pain abdomen. So first of all, we need to ask what is the duration of pain abdomen, okay, and then the site of pain abdomen. If the patient is having any peptic ulcer disease, then patient will complain of, most of the time the patient will complain of pain abdomen in the epigastric region. The type of the abdominal pain, character of the abdominal pain is very important once again. So it is very important that we ask about the character. Most of the time, if it is due to acid peptic disease, the pain will be of burning type. The patient will have complaint of burning type of pain in the epigastric region. Okay. Now we need to ask if there is any radiation of the pain or not. Okay, whether the pain radiates to any other region or not. Okay, many of time if there is pancreatitis, the patient will complain of pain in the epigastric region, as well as the patient will have pain at the back also. Okay, and very importantly, if there is any pancreatitis, the patient will say that as soon as the patient sits up and bends forward, there is a relief of the pain. So that history is very important if there is any relieving factor or any aggravating factor of the pain. Okay, many of the time if there is duodenal ulcer, the patient will have typical relationship with food and the pain abdomen. In case of empty stomach, the pain abdomen usually aggravates if there is any history of duodenal ulcer. Okay, if there is any duodenal ulcer. But as the time goes on, if the ulcer becomes chronic, then the relationship with food it is lost. Okay, but initially it is very much, the pain is very much related with timing of food intake. Okay, so this is about the pain abdomen. The next I was talking about nausea and vomiting. Okay, so if there is any vomiting, these are the following questions we should be asking to the patient. Okay, for how many days there is vomiting? Okay, how many episodes the patient had of vomiting? Then what is the type of vomiting? Is it a projectile type vomiting or non-projectile type? If it is a projectile vomiting, usually there will be no complaints of nausea. Nausea means feeling of vomiting, means someone is feeling like vomiting, that is nausea. So in case of projectile type of vomiting, the nausea will not be there. If it is non-projectile, the patient will have nausea, which will be followed by vomiting. Okay. Now, what does the vomitus contains? Okay, what is the content of the vomitus? Okay, is it food particle or is it only liquids? The color of the vomitus. Okay, if there is any blood along with the vomitus, which is known as hematemesis. Okay, bleeding in the vomitus. Okay, or vomiting out blood, that is hematemesis. Or if what is the odor of the vomitus, if it is very foul smelling or not, that is also very important. So this is about the history of vomiting. Okay, other than peptic ulcer disease, GI system involvement, there may be viral hepatitis also. Okay, your patient may present with symptoms of viral hepatitis. So along with the pain abdomen, there will be fever. And the pain abdomen, in cases of viral hepatitis, it will be acute in nature. There will be dull aching, non-colicky pain, non-radiating. The site of the pain will be in the right hypochondrium, that is right upper part of the abdomen. So this is about pain which is there in case of viral hepatitis. Now, along with the pain abdomen, the patient will also have complaints of fever, because it is infection. Hepatitis means infection of the liver, inflammation of the liver. So viral hepatitis, there will be associated fever. Then we can ask the history pertaining to fever. We can ask various questions like how is the grade of the fever, then for how many days the patient is having fever, then how many episodes of fever the patient had, if there is any chills and rigors associated with the fever, okay, and if there is any relieving factor of the fever, whether the patient took any medicines to get relief of the fever, okay, or if there is any aggravating factor of the fever, or if there is any associated complaint along with the fever. So this is about fever, which can also be a chief complaint of a patient who is presenting with the gastrointestinal system involvement. Now, the next chief complaint can be abdominal distension, which is again very important. Many a time we will be dealing with cases of hepatic problem, chronic liver disease, okay, alcoholic liver disease leading to liver cirrhosis. So these cases, they may present with abdominal distension. So how we explain about abdominal distension, or what are the questions we're supposed to ask about abdominal distensions are when patient notice the distension, okay, means what is the duration of distension, okay, initially how much was the distension, is the distension is remaining static or it is progressing, okay, if it is progressing then it has progressed over a period of how many days, okay, and along with the abdominal distension, if there is any swelling of lower limbs or not, that also we need to mention. We need to ask about any facial puffiness as well, okay, and we need to ask along with the abdominal distension if there is any breathing difficulty or not, okay, and because abdominal distension will result in pushing up of the diaphragm, and there may be breathing difficulty associated. So that is also important that we ask about any breathing difficulty associated or not, any associated pain abdomen is there or not, that also we need to ask about, okay. Then one more chief complaint of the patient may be jaundice, okay, or icterus. So patient will complain of yellowish discoloration of sclera or maybe skin. So we need to ask the patient what is the duration since when the patient has noticed the yellowish discoloration of eyes or the skin, okay, if there is an associated itching over the skin surface of the body or not, that is known as pruritus. So asking about pruritus is also very important, okay. Then if there is jaundice, then whether the jaundice is progressive or not, whether there is deepening of the yellowish discoloration or not, that is also we need to ask about, okay. We need to ask about the bowel habit and bladder habit, okay. So once we have elaborated the chief complaints, now if there is any jaundice, then we need to differentiate whether it is a cholestatic jaundice, that is obstructive jaundice, or it is a non-obstructive or medical jaundice. So how we can differentiate from the history? We need to ask few questions like if there is pruritus or not. As I say, pruritus means itching over the skin surface. What is the color of the stool? Okay, stool is usually clay colored in case of obstructive jaundice. So in case of obstructive jaundice, there will be pruritus, there will be clay colored stool, urine will be dark color, okay, there will be associated pain abdomen, and there may be associated vomiting also. So pruritus, clay colored stool, and then dark color urine, then pain abdomen, then vomiting. These are the few symptoms from which we can think of obstructive or cholestatic jaundice. So that is very important, so that we differentiate between obstructive and non-obstructive cases of jaundice from the history itself, okay. So once we have differentiated whether it is an obstructive jaundice or cholestatic jaundice, now we know that there is involvement of the liver, as the patient has presented with ascites, that is abdominal distension and jaundice, okay. So now we know that there is liver disease, okay, or there is liver cirrhosis or CLD, whatever. Now we need to ask about the complications of liver cirrhosis. That means patient is already landed up in decompensated cirrhosis or not, if there is any complications of cirrhosis. For example, we need to ask about if there is any upper GI bleed. For example, the patient will complain of melena. Patient will complain of hematemesis. Hematemesis is vomiting of blood. Melena is passage of black, tarry, semi-solid stool. Okay, that is one of the sign of upper GI bleed. Whether the patient is passing blood per rectum or not, that is known as hematochezia. Hematochezia means passage of blood per rectum. So these are complications of liver cirrhosis, which leads to portal hypertension, and portal hypertension leads to variceal bleeds, okay, resulting in upper GI bleeding and all. Okay. Other than that, we need to ask about the sleep pattern of the patient. If the patient's sleep pattern is altered, patient is sleeping more at daytime, okay, instead of sleeping at night time, that means altered sleep pattern or reverse sleep pattern. That is also very important. Okay, from this we may know if there is any complications like hepatic encephalopathy or not. So once we have asked about the complications, we need to ask about certain other important histories, like for example, if there is any history of recent blood transfusion or not in the recent past, there is any history of vaccination against hepatitis virus or not, hepatitis B virus specifically. We need to ask about if there is any high risk behavior, like for example, if your patient is using intravenous drug or not, abuser, okay, intravenous drug abuser or not. So this is also very important. So these small histories will guide us towards a specific diagnosis. So this is about the history of present illness, how we describe the chief complaints, how we elaborate the chief complaints. We talk about the associated complaints of the patients, how we need to differentiate between cholestatic and non-obstructive jaundice, okay, and how we talk about the complications of liver cirrhosis, okay. So this is about the history of present illness in case of involvement of the gastrointestinal tract, okay. Now in the past history, it is like somewhat it is as visual, like other for other systems also, the way we take history of past illness, we need to ask about any chronic diseases the patient is suffering from or not, like for example hypertension and diabetes, okay, because diabetes is also a very important cause of liver disease, which is known as NASH or non-alcoholic steatohepatitis, okay. So that is very important. And we need to ask about any history of jaundice in the past or not, or any history of hepatitis in the past or not. So these are very important that we ask about. In the personal history, we definitely need to ask about patient's food habit, then patient's any high risk behavior is there or not, patient is abusing alcohol or not. That is also very important, because we know that alcoholic liver disease is one of the very important cause of liver disease, okay. Now in the family history, we need to inquire about if there is any similar illnesses in the family, okay, because many of the liver disorders, like for example Wilson's disease or hemochromatosis, they can be hereditary, they can run in the family. So it is very important that we know about the similar kind of complaints like abdominal distension, jaundice, or someone has expired of any liver disease in the family or not. So this is very important. So this is about the history taking as a whole for a case of gastrointestinal system. Definitely I could not describe everything about the history, but I have just discussed about the common chief complaints with which a patient may present with if there is involvement of gastrointestinal system. Thank you so much for listening to my class. I hope it was helpful. Thank you.